Thank you. Good. Next slide, please. So we've got 5 key learning points that we'd like you to take away from the session today. The first one, which seems like it might be helpful, is exactly what is framework analysis. We'd also like you to understand when it's useful to use. Rebecca's going to take you through the steps, the analytical steps that you go through when you're undertaking framework analysis. And then I'm going to go through the strengths and weaknesses and give you some tips and advice about how you can ensure rigor and transparency in your framework analysis. And then finally, Hernie's going to take you through a worked example of a global health project that has used framework analysis, and that's the Fusion project. And she'll tell you more about that later on. Okay, next slide, please. Thank you. So framework analysis is a popular and commonly used approach, and it's used in qualitative data analysis. It was developed in the late 1980s by Ritchie and Spencer from the National Centre for Social Research. And whilst it's a popular and commonly used method, there has been some confusion about when to use it, how to use it, and how to critique it. So this is why in 2013, Gail and colleagues developed this paper that we're heavily going to draw on today, which is a very pragmatic and practical and useful paper, which outlines the steps that you need to go through when undertaking framework analysis. It was originally an approach that was used for social policy research, but as you'll be aware, it's much more increasingly being used in health research now. In terms of where it sits in the landscape of qualitative analysis, it's generally regarded as a type of thematic analysis or a type of qualitative content analysis. And in these types of approaches, in thematic analyses, we look for similarities and differences in the data and try to identify relationships between different elements of the data in order to either describe or produce explanations that are generally underpinned by a set of themes. But a key feature of framework analysis is the organization of data into a matrix, which includes cases, which are put into rows often within an Excel sheet, which usually represent an individual participant, but can refer to a predefined group or sometimes an organization or setting. And those cases are complemented with codes which appear in columns, and these will include summarized data relating to that code for each case. And this gives us a systematic way of reducing the data so we can look at our data set by participant. And using this matrix, which Rebecca will tell you more about later, should also ensure that elements of participants' accounts stay connected to other parts of it. And we also include a summary about that participant, so we're not losing the context in which the interview is undertaken. Interpretation is a key stage in framework analysis, and this involves comparing data within individual participants, but also across different participants or different groups so that we can start to develop our themes. Next slide, please. So when you use framework analysis, this really depends on your study objectives. So framework analysis is a very versatile approach, but it's particularly useful for studies that aim to inform policy or practice. When you want to involve other types of researchers in your study, so maybe clinicians, patients or service users, or members of the public, when you want to involve them in the analysis process, framework analysis is particularly useful. Framework analysis is usually used for interviews and focus groups, but you can use it on other types of data like diaries, field notes, or observations. Framework analysis is really helpful as well when you've got a large data set and you want to generate a holistic and descriptive account of that data set. So for example, you might want to find out what the barriers and facilitators are to using a particular intervention. And you might have data from a large number of stakeholders. So framework analysis is particularly helpful here when you're working with large data sets. It's also helpful when you want to retain the original context or the original detail about each participant, because you can build that into the matrix. So there's an example here on the slide. So this was a study that used framework analysis, and it was a study that involved semi-structured interviews with 31 nursing students, and the aim was to explore their experiences of clinical placements and their educational needs in relation to infection prevention and control. So framework analysis isn't particularly useful when you're working with a highly heterogeneous data set. And I'm going to say this right from the outset, it also isn't the easy option. And I'll talk a little bit about that later. There's lots of different steps, there's lots of different things to include, and people often choose it because they assume it'll be the easy option for analysis, and it's not. And hopefully we'll get that across as part of our presentation today. Okay, next slide. So as I said, we're going to draw heavily on the Gale et al. Paper from 2013. And this was a really helpful and accessible paper, and they outline a seven-stage process to framework analysis, and the reference is included here. So I would highly recommend that you get this paper and use it if you're going to plan to do a framework analysis yourself. Okay, next slide. Over to Rebecca now, I think.
Thank you, Helen. Yeah, so I'm just going to go and talk through those 7 stages a little bit more in detail. So stage 1 in the process is actually outlined as transcription. So it's important to get a really good quality transcription when you're going to look at data from qualitative interviews or focus groups. You want a really good quality recorder, and the transcription needs to show everything the participant said, word for word. Sometimes that's called verbatim. And transcription, even though it's a really long, it can take a lot of time, it's a lot of work, it can also be really useful to analysts because it helps you become really familiar and immersed in the data. And a few tips from our experiences of doing this process. It's important to also make sure your recorder is secure as well as a good quality one. So I've got mine here. This is, I don't know if that shows up very well, but this is an Olympus one, but there are other brands, obviously. This is an encrypted device. It's got a passcode function as well, so that if in the worst case scenario, the device was to fall in the wrong hands, this wouldn't be accessible. This data wouldn't be accessible to anyone picking up the recorder. So it's just to safeguard the data, because obviously in qualitative research, often data is really sensitive and personal to people, and it's important we protect it. And it's also good to practice using that recorder because you want to maximize the chances it's going to work on the day. So yeah, practice understanding how to make it what it will look like when it's recording. My device shows a red light when it's recording, for example, and so when I press record, I make sure that light is showing, and I maybe keep glancing at it throughout the interview to make sure it is actually still recording, because you don't want to get back to your office and find that it didn't work. And also during the actual transcription process, it's useful to add page numbers to your transcript and line numbers, because later on when you're wanting to refer to maybe a good quote you've seen, it's much easier if you can say, oh, it was on page 20, line 30. That's quicker to refer to than actually typing out the whole quote or copying and pasting, which takes up lots of space. And also, it's good to anonymize the transcript when you're going through it. So you want to be able to take out any personal identifiers that might link to a person or an individual. So for example, if someone mentions a name in that transcript, rather than transcribing that name, you can actually just remove it at that point and then just maybe put brackets name to show that something's been taken out. Thank you. Next slide, please. Thank you. So stage 2 is familiarization. So that's the process of becoming really immersed in the data that I just mentioned. So it's the process of reading the transcripts really carefully, line by line, noting down ideas or thoughts or impressions as you go. It can be really helpful to listen to the recording at this point, but it's not always feasible with the timelines, depending on the project. But there's always extra information you can pick up from that audio recording. Even though you can indicate some of this in the transcript, sometimes pitch and the speed and the way someone says a particular thing might come across a little bit differently when you listen to that audio recording. So that can be really helpful. Thank you, Navitri. Stage 3 is coding. So coding is the process of assigning codes or labels to the data to describe what that piece of data is about. So you're working through the transcript line by line. And in Framework, you're not restricted to one type of coding. It can be inductive or deductive or both. And for people who are not so familiar with that, so deductive coding is where you've predetermined your codes or your themes already by a theory or a framework. For example, when we're looking at the acceptability of an intervention, we might use the theoretical framework of acceptability to guide the coding. But other approaches can be inductive, where there's no predefined codes. It's really data driven, and the codes can be really wide ranging. So they could include behaviors, values, emotions, impressions, and they're not restricted in that way. But often people use a combination of both approaches. And Gail recommends that, Gail recommends that at least 2 team members are involved in the coding process, and that they work together and coding the first few transcripts independently. And that's really helpful, where you might have a team where people are from different disciplines. Perhaps you've got people with lived experience. Often we involve people with lived experience of mental health problems in our team. And it just prevents one viewpoint from dominating, because everyone comes to the analysis with a slightly different perspective. So it can be really helpful to have a range of people involved in the process. Thank you. And this is an example of coding, which is taken from Gail's paper, actually. So in Gail's paper, it also has a additional file information you can download. So look out for that, because it's got a really useful worked example of how they've used the framework approach to analyze some data. As you can see, you've got down the left, you've got the coding labels showing. You've got the line numbers showing, which I just mentioned, the transcript in the middle, and the notes and ideas on the right-hand margin. And this is where extra wide margins can come in useful when you're producing your transcript. So you've got a little bit more space to add these codes and labels. Thank you. And in stage 4, so at this point, the coders need to come together and compare the way they've coded transcripts, and to then agree on a set of codes that they're going to use going forward. At this point, you can start to group the codes into categories. So groups of similar ideas will be put under a heading. Often this will be arranged in a kind of tree diagram. But often several iterations, several versions of the framework may be needed before you're not generating any new codes. And as shown in this example, which is again from the Gail additional information file, it is useful to produce a definition of each code. So where it shows the description, they're a list of definitions the team has agreed, and that's just to help the team to work consistently as they go forward, so they understand what each code means and they're applying that in the next stage. Thanks, Navitri. Stage 5, this is now where you're starting to apply that framework that you've developed in the previous stage to your transcripts. So often what people do at this point is give each code and category a short ID number or a label. So maybe 1.1, 1.2, 1.3. That really helps make it quicker when you're applying those the framework to your transcripts. Makes it easier to identify. And while indexing, I think just a reminder to say it is good to keep your discussions going with your wider team at this point, just to make sure everyone is applying the codes, the definitions in a similar way. and just to check in with each other that you're keeping consistency in the team. Thank you. So stage 6, this is charting into the framework. So these are the matrices. This is the point where you're producing the matrices that Helen mentioned earlier. So often you will produce one chart per category, and you're trying to reduce down the amount of data and make it more manageable, more usable to interpret in the next stage. So in these matrices, you've got one row per participant. Sometimes they're called cases. And as you can see in the far left column, you've got an example where you've got the participant's ID. So carer 1 in this example. These are just made up. Female, age category. This is important contextual information that will help with your analysis. And you've got the codes across the top with their ID numbers, 1.1, 1.2 in this case. And rather than putting in full quotes or really detailed information here, you're trying to summarize the data, but stay close to the meaning as far as possible, but shorten it substantially. So you want to make it a bit more usable, a bit less unwieldy when you come to interpret the information. But you can also put references in here. So this is where the line numbers come in useful. In this example, it says in the first row for carer 1, Q, which stands for quote, page 24, line 200. So I know there's a good quote on that page for that participant, and I can quickly and easily go back to it and retrieve it when I come to write up at the next stage, the later stage. Thank you. This is the final 7th stage in the process. So this is the process of interpreting the data. So now you're taking the charts you developed to actually identify the themes that you're going to report in your write-up or in your paper. The aim is to go beyond the descriptions of individual participants at this point. So you might do this by looking for characteristics in the data and to look for connections and relationships within and between participants and between the different categories. You might also, depending on the aims of your study, look for things like typologies where you can group participants together by some common feature. Thank you very much. Oh, just to mention as well, often, and Gail mentioned this in the additional information file, you'd expect to find more than probably several categories. A theme will be made up of several categories to give you an idea of how that moves forward. Thank you. I think it's over to Helen.
Okay, so I'm going to briefly summarize some of the strengths and weaknesses of the framework analysis approach, some of which you may already have picked up as part of the presentation so far. Just noticed there's a question in the chat. We can pick that up probably at the end, if that's okay, Nadia. We're going to keep the Q&A to the end, but we'll make sure we address that. So one of the strengths of the framework analysis approach is that it's systematic. There are those clear 7 steps that Rebecca's talked about that you can work through as the process of analysis. This is quite appealing, especially to novice researchers, because often qualitative research and qualitative analysis can feel quite grey and a bit of a black box, really. It's not clear about how you get from your data to your themes. So Gail's outlined these 7 steps with a view to kind of making it a bit more systematic. Also, the matrix, the Excel sheet or the Word document is a really clear kind of audit trail and demonstrates again this systematic approach. Each transcript is treated in the same way. It's also very flexible, so it's not aligned to a particular philosophical or theoretical approach. That's not to say you don't need one, it's just to say it's not wedded particularly with one type. It can also, as Rebecca said, incorporate either inductive or deductive coding, or often more commonly a combination of both. So even when we're using a pre-existing framework to analyze our data, that doesn't mean we only look through that lens at the data. So we need to make sure that when we're using a framework, an existing framework, it's not closing our eyes to other relevant and important data that's within that transcript. So when you're using that framework, you should also be looking out for things that fall outside the framework. So you're drawing on a combination of both inductive and deductive coding. As Rebecca said, it's really nice in terms of multidisciplinary work. It's really good in terms of involving less experienced qualitative researchers or members of the public or people with lived experience, because there's this systematic approach with clear steps. It's also helpful, and I'm sure some of you are working on projects like this already, when you've got a large data set, when you've got multiple researchers, when you've got a lot of data to work through, because again, it gives you this structured approach. So all analysts are working through the transcript in the same way. So on STAN, for example, we're going to have, I think, over 100 participants involved in our phase 1. So we've got a lot of data to work through, and we've got lots of different researchers working across different sites. So we're going to use framework analysis because it gives us a shared approach in order to conduct that analysis. Framework analysis allows you to compare within a participant's account, so you can compare one thing that they say to other things that they say to really develop your understanding of that participant's experience. But it also allows you to compare between participants as well. So you can compare and contrast different participants, perhaps maybe based on some demographic characteristics or some predefined aspects that you're interested in before you start. You can also compare different stakeholder groups. So you might want to compare people with lived experience and their family members and professionals. And framework analysis is a really useful way to do that. It's great in terms of the matrix. It really enhances the transparency of the analysis process. And I'm sure you've come across this term before, but it's a really important quality indicator of qualitative analysis. So often qualitative papers will be critiqued for not being transparent enough in terms of how themes were developed, how the data was analysed, how analysts undertook the analysis in the same way. There is a bit of a caveat here. So whilst it's really helpful in terms of visualising as well the strength of themes, or where there's gaps in a particular framework, what you shouldn't be tempted to do is then quantify your themes. So I'm sure you've seen it before in papers where people will say 13 out of 20 participants felt this, and actually that's not what framework analysis is indicating at all. So framework analysis is still qualitative. We're not sampling in order to generalize to the wider population. We undertake purposive sampling to either get a particular set of participants' views or to obtain diversity of views on a topic. So if you see that in a paper, be cautious that they probably haven't used Gale's framework analysis approach. If you submit a paper to a journal and they come back and ask you to do that, which I've had in the last 12 months a couple of times, be confident to push back, particularly if you're using this approach, because Gale says within her paper that's not appropriate for framework analysis and shouldn't be used. So be confident to push back if reviewers or somebody, or maybe whoever it is, tries to get you to quantify the number of participants who are expressing particular views. That's not compatible with most qualitative approaches, and it's not compatible with framework analysis. Okay, next slide. So here's the downside, the bad news, if you like. There are some weaknesses to framework analysis. So people will often select it and think, okay, this is the easy option. There's clear steps to follow. This is what I'm going to do. It'll make things a lot more straightforward and simple. Well, the bad news is that it's incredibly time consuming. So most qualitative analysis is, but there's more steps in this process. There's also a very high training component. So we've already touched on that at the moment. So this would be the first step in terms of outlining the steps of how you do framework analysis. But then there's a lot more work to do after that. So you also need to make sure individual analysts are trained in framework analysis, but also that you understand, if you're using a deductive framework, make sure everybody understands what the different codes and categories mean. So Rebecca talked before about having a definitions file, and we'll do that now with all our framework analysis, have another tab on the Excel sheet, almost the first tab, which we refer to as a code book, where each code is labeled, but there's also a working definition that follows it. And that can be an iterative document that's worked on throughout the analysis process. So as your understanding of the code and the categories develop, that code book gets updated as you go through. So it's very much a live document that everybody contributes to, and it really helps have that shared understanding of different codes and categories. And even when you're using a framework like the theoretical framework of acceptability, there's still going to be some translation work because they're concepts. What you need to do is translate those concepts into your study, into your data, and make sure that everybody has an understanding of that. And again, that is a live process. When we've even done all these different steps, we will still meet on a weekly basis or a bi-weekly basis to make sure that we're not interpreting things in a different way, that everyone's on the same page in terms of what codes and categories mean. So it's really helpful for people to bring any tricky things to those meetings to discuss with other analysts about how they might code it. So that understanding of your analytical framework really evolves over the process of undertaking your analysis. It's also worth saying that framework analysis doesn't work with all types of research questions. So if you're looking to really develop an in-depth understanding of what it's like to live with and manage a chronic illness, that's probably still better addressed using a phenomenological approach. If you want to understand how health professionals and patients interact in a care planning meeting or a particular type of clinical interaction and how they communicate with each other, that's going to lend itself to a discourse analysis or a conversation analysis. There's no specific theoretical underpinning. And again, that can be seen as a strength, but you should consider where you position yourself theoretically as researchers. There's also the danger of data being broken down to a level that it becomes meaningless. So I guess then we're also talking about making sure that we're keeping those data, those summaries contextualized. And that should be helped by the section, one of the earlier rows where you provide some kind of description about the participant, who they are, what groups, and some demographic characteristics. Okay, next one. I'm going to talk briefly, because we're nearly at the end of our time, aren't we, about how we can ensure rigor and transparency in our framework analysis. So as we've already said, the systematic process in framework analysis, the development of that matrix, really strengthens rigor and also transparency. So you can see how when you're filling that matrix in, you're developing your audit trail as you're going through. It's going to be really clear about how your analytical framework was developed, how it was applied to transcripts, how analysts kind of compared and contrasted their own analysis to make sure everyone was interpreting and coding in the same way. This is still qualitative research, so there's still lots of things we need to take into account. Framework analysis isn't a solution to all the problems or challenges with qualitative research. We still need to make sure that we're keeping reflexive journals or research diaries. Every analyst should be keeping one of these in order to record decisions, to document your emerging ideas and reflections, and to consider how you as a researcher might be bringing your own assumptions to the research process. You can also do some member checking. So asking people from the group that you're looking at, that you've been speaking to review your analysis, to review your interpretations. So we've got, as Dr. Amantia said this morning, we've got a community engagement and involvement group. We've also got a patient and public involvement group on stand. So as part of our analytical process, we'll be taking back our codes and our definitions and our analysis as it develops to get their input, to make sure that kind of our interpretations are grounded in their experiences. You can also incorporate triangulation into framework analysis, so collect more than one type of data and compare and contrast to really kind of increase the credibility of your findings. As commonly used in qualitative write-ups, we should be using quotes to support our assertions in presentations and in write-ups. One thing I think about framework analysis that's very helpful is that a trap that people often fall into with qualitative analysis is that their themes, are just one word. So often when you see a paper, the theme might just be barriers. But what framework analysis wouldn't really let you do that, because framework analysis would say that would be a category. And actually you'd need to combine categories in order to interpret themes. So following this process, you should really be developing well-interpreted and in-depth themes rather than just one word themes. So just to talk a little bit about reflexivity, again, it's so important in qualitative analysis, and it's just as important in framework analysis. So as researchers, we're still going to influence the data analysis process. So reflexivity is really paramount. We need to make sure that we're flexible and reflexive in our analytical process so that we can adapt to new data as we analyze it, and we can develop an analysis that reflects the complex topic or the complex phenomenon that we're looking at. As I've already said, I'm going to say it again, that everyone should be keeping a research diary and should consider from the outset of the analysis or the outset of the study really, what their own position is in the research and what they're bringing to this research as an individual. But also considering how this develops over the course of the project, because we'll change ourselves, our views will change as researchers as we engage with the data and we analyse it. We should be making memos, so that Rebecca's already indicated how you can do that on the transcript itself. You might also want an additional file to document your thoughts and reasons for interpretation whilst you're coding, whilst you're indexing, and whilst you're charting. And this is going to be really helpful to you when you come to that later stage 7, when you look to interpret your categories and codes and do the write-up. And if at all possible, we should try and ensure that collection of your data and your analysis run concurrently so that we can use our analysis to inform the data collection, and we can really then develop an in-depth and nuanced understanding of our topic of interest. And that's it. The next couple of slides are, I think, some references. So what we've done is include obviously the Gale et al. Paper, but also some other examples. And as Rebecca said, the supplementary information file in the Gale paper is incredibly helpful as well, if you want that kind of concrete and practical example of how it's been done before. And there's some more references on the next slide as well, isn't there? Let's have a look. Yeah, so just some more references. We've been pretty comprehensive. There's lots of different ways you can go with this. And so I'd have a look at all these different references as well if you're interested in taking this forward. Okay, I think we're handing over to Hernie now.
Thank you, Dr. Brooks and Dr. Pedley for the lecture. This is a very interesting, very insightful lecture, yet very challenging to comprehend everything for a newbie like myself. But don't worry if you're a newbie like me. In the next lecture, we are going to listen to the application of this framework analysis. We will have Dr. Hernie Susanti from the Faculty of Nursing, Universitas Indonesia. And Dr. Susanti is also the principal investigator for the GHG SUN. The title for her lecture will be Illustrative Example of the Use of Framework Analysis Method from a Studies Fusion. So Dr. Susanti, the sum is yours.
Yeah, thank you, Mbak Fitri. Good morning for UK Fellows, Rebecca, Helen, and also the others. Good afternoon, selamat sore Bapak Ibu semua, teman-teman dari Indonesia. Yeah. Please allow me to use in English, yeah, with my limitation in English. But hopefully it still can help that the UK can follow me. Otherwise, we can use the chat room, yeah. Okay, so my turn is I want to show you about how the framework analysis has been implemented in one project that I'm also doing the project with UK Fellows, yeah. The project's name is Fusions, and Fusion is a project for developing family intervention for people with schizophrenia. Beside myself as the researcher of this fusion, we also have Dr. Lisa Renwick and also Dr. Helen also involved, and others, yeah, like Prof. Budi and also the others. I think some of them is also being here. So let me begin how this framework analysis has been implemented in the fusion. But for your information, I am myself has been familiar with the framework, I think since 10 10 years ago, more than 10 years ago when I did my PhD. So I used my PhD also with this framework analysis. So it is very contented that in this research, the STAN research and also the fusion research, we also use the framework analysis. So what I want to explain here, I also use the 7 steps as also explained by Helen and Rebecca previously. Next, please. So this is about the fusion that I have mentioned before. So the fusion itself is a research funded by the Medical Research Council, UK. It's a research for 2 years. Based in Indonesia to reduce relapse for people with schizophrenia. And then we develop a culturally relevant evidence family intervention. So the research is really how to adapt and also to define evidence-based family intervention. We are developing family intervention which already has established in the UK particularly, but how this intervention can be implemented in Indonesia. So what we did before we are delivered in intervention with the trial study, we explored by qualitative research. So this is the part of fusion that I will explain when we explored the perspective of participants about the family intervention. So we use quantitative and qualitative, and in this part, I will explain again about the qualitative part. We use focus groups and there's in-depth interviews, yeah, but I will explain particularly for this framework explanation for the focus group study. Next, please. So what we did for the focus group, we have in total 51 participants, and those are up to 80 years, yeah, from 3 stakeholders, or sorry, from 3 stakeholder groups or three groups of people. The first is patient or service users, the second is family or carers, and the third one is health professionals. Altogether, there were 6 focus groups. So each stakeholders stakeholder, we did 2 focus groups. Yeah, so altogether 6 focus groups. And then the topics covered in focus group, we use the dimension of cultural adaptation from the framework developed by Degnan and et al. About the nature and efficacy of culturally updated psychological intervention. So this is what we use, I call it the reference that we use, how to analyze or using this framework analysis. I will explain you later on. Next, please. So as explained by Rebecca and also Helen, we also use Gale approach for this framework analysis. So the first step is transcription. During the transcription with these 6 focus groups, so we have 6 transcripts, yeah, we ensured there's similarity in transcription style across the whole document. So what we did, we also involved some researchers from postgraduate student in the nursing faculty. So we had at least three Indonesian researchers that involved in this analysis. So including for the transcription. So from the beginning, we made sure that the transcription style were the same. Yeah, and then we use this format as shown on the PPT on the screen. Yeah, so there were 3 columns: code for coding, transcription, and ideas. For code and coding, we leave it in blank because in the first step or even the second step, we haven't done the the coding yet. Yeah. And then the ideas column. So this is very important, particularly for the next step that I will explain later. So as I mentioned, we have Indonesian researcher to responsible or carrying out this data analysis, yeah. And then we check all transcript by errors, for errors by reading and listening back to the audio recording. Yeah, for your information, because Fusion is international collaborative research, so some of the transcription also translated, yeah, were translated into English, and then also, of course, the analysis also involve the UK researchers here, Dr. Helen Brooks, and also Dr. Lisa Renwick. Next, please. So this is the second step. It's about familiarization with the focus group. Yeah, as also mentioned or explained by previous speakers. Yeah, and it's still use Gale approach. Yeah, and then the goal of this step is really to be more familiar with the data. What we did is we chose 3 of the 6 transcripts to complete this step. Yeah, and then at the same time, when we did reading, and then some of them we also listen to the recording again. We use the document that I will show you later. Yeah, to help us in doing this familiarization. Next, please. So this is sorry. Can you go back? The highlighted note there were those that we selected to be used for the familiarization. Okay, so this is the example what we did for the familiarization. As you seen that there is the column of ideas that we already have prepared. So what we did when we read the transcript, what come up from our thought, we put it, we wrote the ideas on the column. So this helped us to really not only to be familiar, but we also understood what is the data about, what was the participant said about, whether it was in the context, whether it was also quite answering our research questions. So those are the things that come up in our thought. We will write it down on the ideas column. So this is the example, yeah. Of course, to make it more focused, we use underline. So what we did, simply we use Word, what is it? Yeah, Word, yeah, not Excel, yeah. Using the format of review, and then we can use or type the ideas there. Next, please. So after we completed to be familiar with some of the transcript, we still use the 3 transcript for coding. Yeah. The goal of this step is to classify data from the 3 transcript that's already reviewed from step 1, so that we can compare systematically with other parts of the data set. So start from this step, we were using Deknan et al. As the framework to apply the coding by assigning codes to segment of text. I will show you later. The next slide, please. So this is the coding. Yeah, this one. So as I mentioned that we use Gale, yeah, to start, because Gale paper here, Gale et al. Paper here, from the I think it is a robust systematic review and meta-analysis about the family or psychosocial intervention, which is connected to the culture adaptation. Yeah, according to Gale et al., when we are doing when we are studying about intervention, yeah, especially for schizophrenia, which is connected to the cultural adaptation, there are 9 components. Yeah, and these are the things that we also use as the code from 1 to 9, as you seen on the screen. It's about how about the language, how about the concept of the illness models, how about the family itself, how about the communication, up to the 9 code. It's about how the treatment goes. Yeah, okay. So when we already have the codes that really derive from the Gale et al., yeah, we start code, and then again, I will say and I will emphasize, when we did it in the beginning, we used 3 transcripts still. Yeah, so this is what we do. This is what we did. Yeah, the code or coding column can be filled now. Yeah, for example, from the transcription, well, I can read here. Yeah, I think there should be a discussion with the family, right, part of the parameters. So in this part, I will what I did is really to to go to the code. So this statement or this code belong to coding 3. What is coding 3? Coding 3 is about the family. Yeah, so that's what we did. Yeah, and also when the participants said, I think it's also necessary how to speak, to communicate, to ask for help or ask for something. So the statement here is really belongs to number 4. Yeah, can you go back to number 4, Novitri? Yeah. So number 4 is about communication. So that was we did across 3 transcripts. Next. Yeah. Okay. So when we completed to do the coding for the 3 transcript, we went on to the next step. The next step is developing a working analytical framework. Again, we used Gale et al. Yeah, we found that there was no really big change, yeah, from the code that we already set. Yeah, but what we did for this step, all researchers in Fusion, we met and we compared the coding that have been made from 3 transcripts. At that time, it's Indonesian researcher. Yeah, as I mentioned before, we did the analysis with 3 Indonesian researchers. So everyone did the coding for 1 transcript. Yeah. So all researchers, yeah, we met and then we compare the coding that have been made from 3 transcripts from the 3 researchers and also reviewed by the UK researcher. Yeah, and then we agreed, yeah, a set of codes and also the description to be applied to all subsequent transcripts, because we still have 3 more transcripts to be coded. Yeah. Next. Yeah. So this is what we have agreed. Yeah, they're still the same. We use the Degnan code. Yeah, but from the developing stage here, we already have agreement or consensus about the description. So what is the concept of illness? What is the family? Yeah, if I'm not mistaken, we put the component of stigma here because it was really apparent from the data. Stigma come up from many participants from the focus group. Yeah. Okay. Next, please. Yeah. Okay. So after we finish, we had the consensus. We went on with to the step 5. Yeah. For this step, we apply the analytical framework to all transcript. So what we did, we went on to code, or to do the coding for 3 other transcript. So this is what we did. This is what also have mentioned by Rebecca and also Helen. We called indexing. It's like coding, or we read line by line, and also again we identify this statement belongs to what code, something like that. Yeah. Perhaps you are questioning whether there will be a modification for the coding, for the coding, or maybe from the coding it's also become the theme or categories. Yes, For your information, for this fusion, we have not completed yet, especially at the end of the stage. But let me explain the next one. For step 5, we have completed. Next, please. And then we already have done the step 6, that was charting data in the framework matrix. So what we did, because we have 6 focus group, and we already have the some categories, 1 to 9. So we did we did charting or matrix like this one. This is only for example. So case ID is for the focus group, that is to denote which focus group. So for example, this is for focus group family 2. So from the focus group family 2, of course, when we saw the transcript, we can make sure that on the focus group, there is data about language, there is data about concept and illness, there is data also about family, and also we identified for all of the codes, that we have said before. And then, as also has explained before, on the charting data here, we don't put really the quotes, but we use like a more condensed or like a brief summary. But the summary is not is still close to the raw data, to the quote or the statement of the participant. Next. So this is the interpreting, The interpreting, we are still in doing the interpreting at this moment. This is that I said before, we're not really finished yet for this fusion data analysis, but we are now in the process of interpreting the data. So we're looking for point of consensus and divergence in opinions between stakeholders, to inform the co-adaptation workshop, and then the key point of the divergence were taken forward for agreement, because this research is really want to know what is actually the family intervention that is suitable for Indonesian context from the perspective of patient, from the perspective of family, from the perspective of health workers. So what we are doing for this step, we really want to make sure that those expectations about family intervention could be figured out. Next. Okay, so I think that's the end of my slide, my presentation. And again, the reference, of course, you can see Gail and also Deknan. And then feel free to have a discussion with me and also the Fusion team. Thank you very much.